should community members know about the program? What will they be doing exactly with the students?
So the community members will be the patients. So we want them to know that they're going to be portraying the demographics that we see here in East Texas, and we want our students to be able to know how to work with their community from early on, even as early learners. And so we definitely want to engage the community, as these will be the patients that they will have.
Well, it's a great way to give to the community, be part of this program. You're enabling students to learn how to talk to patients and how to do physical exams before they actually go out and do that with real patients. So it's safety for everybody around. It's a safe environment for the students and for the simulated patients, and it's safety for the patients in the real world too. They'll have a more confident, more capable student who works with them.
And why is the school needing community members to role play as patients? I said earlier, what's the difference between an actual person versus a dummy, you know?
So what's different about being a simulated patient is just that you're going to be learning and you're going to be trained to be a simulated patient. Some of the things have to be standardized, and so sometimes you'll be memorizing or learning a script, and you'll have some training to be standardized. And also, I think just the feedback that the students will get, right? It's going to be trained also. The patients will be trained to be able to give feedback to the learners so that they can really optimize their learning. So that's really the big difference between having a real patient and having a simulated patient, is they're really trained to be able to help the learners grow.
And how excited are you about this patient program? Is it something that hasn't been done here before in the East Texas area?
So in East Texas, no. So we are very excited to be the first in this area, and we're very excited to be able to offer this as part of our medical school. And not only our medical school, but lots of the health professions in this area could really optimize using standardized patients in their learning environments.
What exactly are y'all looking for in a patient who auditions? Theater background is what I saw.
Yeah, theater helps, but we're not looking just for actors. I like to make the distinction that actors are there to perform a role, and certainly simulated patients will do that too, but they're doing that in the service of education, and they're there to give feedback, and actors don't do that. So there's that added dimension. We'll use some acting techniques when we're training the SPs, but you don't have to be an actor to be a successful SP. They can come from all walks of life. Teaching is a good one because they're used to working and working with learners. Trainers too, someone with a training background can be really helpful here, but they really come from all walks of life. I've had realtors and weathermen and all kinds of backgrounds. People who have some flexibility with their schedules, though, is really helpful.
Okay, and I saw it was all ages.
All
right?
ages, absolutely, because our patient demographic here in Tyler is all ages. So we want our students to be able to experience that.
And what are your goals for this here in East Texas?
Well, we're hoping that we can recruit at least 40 patients. Again, we want to cover the demographics. So an 18-year-old can't play a 55-year-old with diabetes, right? So we have to be able to cast that according to what the cases are. So we'd like to have a nice rounded pool.
Okay, good. You said 40 of those, and then when can people apply and where?
They can start applying right now. We'll make sure you have the QR code and the link so that people can go straight to on their computers and apply. We'll be doing some SP recruitment days, so those people who have applied will be able to come and learn more about the program, and we'll actually run through a case with them and give them practice so they get a good feel about what it would be like to be an SP.
Okay, and then I saw March 30th, 31st, April 14 and 15. What are those dates?
Those are dates for the SP recruitment day, yeah, that we have established.
Okay. So that's this week.
That's coming up soon, but we'll add more as people apply.
Okay.
The students won't start till the last week in June, and they have another activity to do during July, so a lot of our basic training will happen in June and July.
I think one of the things that I really want to make sure that our students and our standardized patients know is just that it's a very safe environment, that this is something that we really try to provide safety for both the standardized patients, but also our students to be able to learn. And so being able to do that in a safe environment, being able to ask the questions that maybe are difficult and learn in this really hands-on approach, I think is really special.